The central Philippines has been hit by a 6.6 magnitude earthquake. At least one person is dead and dozens have been injured. 14 aftershocks have been recorded so far, with the strongest registering a magnitude of 3.5. Roads and buildings, including a hospital, have been damaged. This comes as the Philippines battles surging numbers of coronavirus infections. The country has recorded 4,800 new COVID-19 cases. 60% of them are in Manila. 7 deaths have also been added. The Philippines remains the worst-hit country in Southeast Asia. Sherry Regalado joins us now for more. Sherry, what's the situation like now? And are there concerns that more people could be trapped?
You know, there's a lot of damaged roads, houses, and public infrastructure, especially in the municipality of Cataingan in Masbate province, which felt a destructive intensity 7. The initial damage report by the Masbate Disaster Risk Reduction and Management Council indicated that some structures collapsed and cracks were seen in the buildings. Many homes with iron roofs have also fallen in. Authorities in Masbate have already advised most residents to stay in evacuation centers or in open areas. They'll have to inspect the damage to their homes. Search and rescue efforts are still underway in the region. The Malacanang Palace says that assistance will be provided to the victims. Presidential spokesperson Harry Roque says that food packs, blankets, and resettlement areas are all ready, as the government is always prepared for such calamities. Roque adds that President Duterte wants to visit Masbate province, but there's no definite plan as of the moment.
And Cherry, we understand that a hospital and a COVID-19 quarantine center were both impacted by the earthquake. What more can you tell us about that?
Yes, this was also in Masbate provinces, the hardest hit area, particularly in the municipality of Cataingan. And some patients were moved out of the hospitals, brought to the tents because there are cracks in the buildings. Now, government engineers were also checking the damage to the sports complex that's currently being used as a quarantine facility center for returning residents. In a nearby town in Palana, several patients in a hospital were also evacuated as a precaution in case of aftershocks. This includes a pregnant woman about to go into labor.
Sherry, restrictions were reimposed 2 weeks ago. That was after medical workers warned that the healthcare system was in some jeopardy. It could collapse. Are there still fears of this happening, given that restrictions, they're due to be eased tomorrow?
Yes, tomorrow, Metro Manila and nearby provinces will be in the less restrictive general community quarantine, where most industries are open and public transportation are allowed. Now, this is despite calls from experts that another 2 weeks stricter lockdown would help in building up the country's healthcare capacity. Some healthcare workers groups are saying that the government still has to adequately heed and address the demand of frontline health workers. However, the government reiterates that it can no longer afford to extend the strict lockdown measures, as this strategy is not sustainable. There are also no funds to help displaced workers. The government instead is pushing for a granular lockdown to be implemented by local government officials, which it says is a better strategy.
Thanks for that. Cherry Regalado speaking to us from Manila.